Children as young as 5 can soon roll up their sleeves for a coronavirus vaccine. The CDC approved Pfizer's kid-sized COVID-19 shot for children ages 5 to 11. CDC Director Dr. Rochelle Walensky gave the final approval.
Walensky said the kid-sized shot was found to be nearly 91% effective in preventing COVID-19 among children as young as 5. Walensky also had this message for parents.
I want to speak directly to parents about this recommendation. We have followed the scientific process. We have done our due diligence. The safety of our children is the of utmost importance to me, and I believe these vaccines will help us to better protect our children from COVID-19.
Soon, COVID-19 vaccinations will begin in private practices for children 5 to 11 right here in central Georgia.
Milledgeville spent the afternoon at Primary Pediatrics to see how they're preparing to give the shots.
Primary Pediatrics received 1,200 Pfizer shots Tuesday. Now they're just waiting to hear from the Department of Public Health to start administering them. Amanda Boakley got vaccinated in April, but her 8-year-old son, Jacob, hasn't been able to.
I asked him, would he rather go to school or homeschool? And he said he'd rather, be homeschooled so he could be safe from, COVID.
So when she heard 5 to 11-year-olds could soon get the Pfizer vaccine, she said she was excited and relieved.
It always felt like he was kind of putting more, at a chance of getting COVID.
According to Michael Hawkinson with the North Central Health District, the district is waiting on guidance from the State Department of Public Health. He said our district is not the authority that decides when providers can begin. Dr. Jason Lee Smith with Primary Pediatrics says the interest is there.
This week I've had several patients come in asking about it and when they can start. Just today, probably 5 or 6.
So now they're just waiting for the green light.
The retail stores are controlled on a federal level, so they may be given the green light before we are in Georgia. We have to listen to the DPH and the ACIP, which are the two groups that kind of converse on vaccines, and when they give us the green light, we can give it.
I'm just thankful that it's come about where they've done testing, that it shows that it is safe for the children to start getting.
Vaccination will begin once DPH receives clinical guidance from the CDC, which is expected soon. They have not provided a timeline though. In Macon, Molly Jett, 13W Amazing News.
So hospitals will not be administering vaccines to children. However, the pediatric COVID-19 vaccine will be available at pharmacies, community health centers, and schools.
The CDC and the Advisory Committee on Immunization Practices support vaccinating children between the ages of 5 and 11.